Welcome to the Practice of Medicine podcast from the Southern Medical Association. Since 1906, SMA has had a singular mission to provide medical professionals with the resources they need to learn from each other and in doing so, improve the overall quality of patient care. The Practice of Medicine podcast is just one of the ways we do that, as we discuss a wide range of topics including multidisciplinary approaches to patient care and new innovations in medical technology. To learn more about SMA's many other services and educational initiatives, please visit us at sma.org.
Food insecurity is a problem for people across the lifespan, and it has been exacerbated by the COVID-19 pandemic. Adults facing food insecurity often reduce the variety of their diet and tend to consume a few low-cost and nutritionally poor foods to maintain caloric intake, and this can put them at an increased risk for a variety of adverse health outcomes. In this podcast, Jennifer Mandelbaum discusses identifying and addressing food insecurity in older adults, a topic she also addresses in an upcoming editorial in the Southern Medical Journal. Thank you so much for being here today.
Oh, thank you for having me. It's a pleasure to be on the podcast again.
Before we really get into our conversation, could you please share with us what exactly is food insecurity?
Sure. So the United States Department of Agriculture, or the USDA, has a couple of definitions, and they divide food insecurity into two categories. The first one is low food security, and this is defined as reports of reduced quality, variety, or desirability of diet, little or no indication of reduced food intake. And then the second definition they provide is for very low food security. And this is defined as reports of multiple indications of disrupted eating patterns and reduced food intake. So food insecurity can touch upon diet quality, eating patterns, and or food intake.
In your editorial, you indicate that research shows food insecurity is a growing issue among older adults. What do you believe is the cause or causes of this?
So the Food Research and Action Center reported in July 2020 a nearly 60% increase in older adult food insecurity during COVID-19. Many older adults had already been struggling to meet their food and nutrition needs, and then the pandemic caused further challenges. And so hopefully we'll get into more of the reasons for that later on.
You share that older adults living in the South are particularly susceptible to food insecurity. Why is that?
So much of the focus of food insecurity research is on children, and I think that's for good reason. Food insecure children are at higher risk for a number of health conditions, including obesity, developmental problems, and poor mental health. And when we're talking about children and any kind of long-term health consequences, we really want to address those early. But food insecurity is a problem for people across the lifespan, and it's a growing issue among older adults. Between 2001 and 2017, the number of seniors who were food insecure more than doubled, and those reached about 5.5 million seniors. And we're finding that older adults experience unique health, financial, and nutritional challenges that come with aging. And these nutritional problems can be compounded by factors like low educational attainment, low income, and living alone. And then there are certain subgroups like dual Medicare and Medicaid enrollees who may be at even greater risk of food insecurity. So I know the Southern US is not a monolith, and after living in the South for a few years, I can see how it's rich in so many ways. But I think overall in this region, we really need to tackle the social determinants of health. And those include things like poverty and educational attainment and racial injustice.
You mentioned briefly at the beginning COVID-19 and the pandemic. Has that had an effect on food insecurity?
Yeah, so this is an example of the far-reaching arm of the COVID-19 pandemic. Since the onset of COVID-19, we've seen food insecurity reach really unprecedented levels in the US. the pandemic has exacerbated hardships faced by people who were already food insecure or were at risk of food insecurity. And this is a time when a lot of people have experienced physical and economic barriers to food access, including things like job loss. And as with so many other social determinants of health, we're also seeing significant racial disparities in food insecurity. So the nonprofit organization Feeding America has been tracking the impact of the COVID-19 pandemic on food insecurity. And in 2021, they projected that 1 in 8 people, including 1 out of every 6 children, would experience food insecurity. And then there's a recent study from researchers at the University of Vermont and Johns Hopkins Bloomberg School of Public Health that found that food insecurity increased by nearly 1/3 among people in Vermont during the beginning of a statewide stay-at-home order in early 2020. Those are just a few examples from the US, and food insecurity is certainly not limited to our borders, but I think it just goes to show how the pandemic is having effects that are very far reaching, including on food access and related issues.
It sounds like it's continuing. It's not just kind of as the pandemic sort of wanes at the moment that it's going away. It's continuing.
Mm-hmm. Yeah, I don't think these are, I don't think there are quick fixes to the problem of food access and food insecurity.
Can you discuss the relationship between food insecurity and poor health? I know we touched on determinants of health, but if you could expand on that just a bit.
Yeah, absolutely. So adults who worry they may not be able to afford food tend to reduce the variety of their diet and consume a few low-cost, energy-dense, and nutritionally poor foods to maintain caloric intake. And this puts them at an increased risk for a variety of adverse health outcomes, including diabetes, pulmonary diseases, cardiovascular disease, and obesity. And in addition to compromising dietary intake, food insecurity is also associated with physical distress, adverse social interactions, and a lower ability to manage chronic disease. So food insecurity really has effects on both physical and mental health. And there's also, I think, important to point out a reciprocal relationship between food insecurity and poor health. There was a really good example of this relationship between food insecurity and poor health in a 2010 New England Journal of Medicine article by Seligman and Schillinger. They described how people in food insecure households are more likely to be diagnosed with diabetes. And then because of their food insecurity, they had poor glycemic control, and it just created this cycle where food insecurity can reinforce poor diabetes outcomes.
Are there tools to screen for food insecurity? And if so, could you share with our listeners more about those?
Absolutely. So there are several validated tools to screen for food insecurity. One of those is the Determine checklist, which is used to screen for the need for food assistance through the Elderly Nutrition Program. And so this isn't exactly a clinical diagnostic tool, but the checklist does help to predict overall health status and identify those whose estimated nutrient intakes fall below recommended dietary allowances. Bidirectional referral systems can also be useful for screening and then linking patients to community resources. So Kaiser Permanente, Colorado, implemented a food insecurity pilot screening and referral program that I think is a good example of this. And they focused on targeted outreach to vulnerable populations and also standardized their screening and referral practices. So they were not only identifying people who were experiencing or at high risk of food insecurity, but also helping to connect them to community resources.
Are there any additional thoughts you want to share with our listeners?
Sure. So I think it's important to point out that screening is just one step in a process to combat food insecurity. We also need to connect people with resources and follow up with them to make sure they're receiving the support they need. So while enrollment in federal food assistance programs is associated with improved health outcomes, most healthcare systems don't have standardized procedures for referring patients to food resources. Among food insecure people, older adults are among the least likely to take part in food assistance programs like SNAP, the Supplemental Nutrition Assistance Program. So we need greater integration between healthcare and community-based systems and services that can connect patients with resources. Related to that point, food insecurity often co-occurs with other social needs. So screening for other indicators beyond food insecurity, such as housing, could be used to better inform clinical care and develop strategies to address patients' medical and social needs. I did want to point out that I originally wrote this piece in response to an article in the Southern Medical Journal about screening in emergency rooms. And I remember this article came out right around the time COVID was hitting, and I just never submitted it as a response, but instead kind of reframed it as an editorial. And I wanted to emphasize that even though I think that screening in any medical setting, including emergency rooms, is useful, like that article discussed, I think primary care can play an especially important role. More than 90% of adults age 65 and older had an office-based visit, at least in 2016, compared to about 20% who had an emergency room visit. So we're talking about a much larger volume of patients who are going through their primary care office. And it might also be more comfortable for folks to be screened by a healthcare provider with whom they already have an established relationship, as opposed to when you're kind of in an emergency situation. So I wanted to use this piece to highlight the importance of primary care and how this might be an opportune setting for healthcare providers to engage in routine screening for food insecurity and connect patients to community resources. With that said, I'm well aware that primary care providers in our country are under a huge strain and experiencing burnout at record levels because of the pandemic. So my hope is that as we can get COVID more under control, primary care physicians will have a little bit more breathing room and can take an active role in addressing social determinants of health like food insecurity.
I think that's an incredibly important point that you've made, and thank you for kind of elaborating on that as well. My follow-up question was just touching on, you mentioned that some people are a bit hesitant to enroll or take part in food assistant programs. Why do you think that is? Is it just concern of what someone may think, or accessibility, or is the process difficult to enroll and it's just, oh, that's too much trouble? Are there just several factors at play there?
I think it's all of the above. So I think there's still a lot of stigma around use of programs like SNAP. I think part of the rebranding to SNAP, as previously known as food stamps, was aimed at reducing some of the stigma around the program. I think it can also be difficult to enroll in social benefits like food assistance, and especially when we're talking about populations that are often dealing with a whole slew of other concerns. It's just one more thing to add to their proverbial plate, and that can be a challenge. So I think it's everything you mentioned. It's access and having the wherewithal to navigate these systems, and also I think some of the lingering stigma around even needing support for something as basic as food.
And to your point regarding access, it's interesting because a lot of places you couldn't go in person during the pandemic. Offices were closed. And if you're in more rural areas, internet access, things that, if you could enroll online, a lot of things, healthcare services, not necessarily food assistance, you couldn't do due to internet. And that was one of the very big things at the beginning of the pandemic. So it's interesting to look at the perspective of food in that regard as well.
Yeah, and I think that was something we touched upon a little bit in the previous podcast I did with you around rural broadband access. So I'm glad you brought that up. I think that's an excellent point.
This has been a really wonderful conversation, and it's interesting to see how it's carried on throughout the past couple of years and what has continued to be issues and things that are already issues in our communities, how they're exacerbated by something like a pandemic. So I think your editorial is very timely. I think it brings attention to an issue that does need attention. And so we thank you for being here today.
Well, thank you so much for your kind words and for having me on. It's been a pleasure.
We hope you enjoyed the practice of medicine. For more episodes in this series or SMA's The Business of Medicine podcast, go to sma.org/podcast or subscribe to us on iTunes, Google Play, Spotify, or wherever you get your podcasts. For more information about SMA's mission, please visit sma.org, and thank you for joining us today.